My name is Bob St. Peter, and I'm the president of the Kansas Health Institute. Again, thank you all for being here. We're more than a month now into the rollout of the health insurance exchanges, or now known as the health insurance marketplaces. And we thought it'd be a good time to hear from people that are involved on the front lines of actually operationalizing aspects of the marketplaces. I think we'll probably hear some positive things about the marketplaces and probably some negative things about the marketplace. For those of you that don't know KHI, we're not trying to promote the ACA or trying to repeal the ACA. We really just want to try to help you all understand the impact on Kansas and Kansans that the ACA is having, and have the opportunity to hear from real experts that really know what's going on at the ground level here in the state. We do believe that bringing knowledgeable people together to talk about difficult health policy issues helps both improve the public dialogue around these issues as well as inform the policymaking process. So you all are the reason we do it, and you're the participants in what we're trying to do, so thank you all for being here. After the panelists make their introductory comments, we're going to have plenty of time for questions and discussion, so be thinking about things that you may be interested in asking as we move through the agenda. I want to introduce the group, and introduce the panel, and as a group, I can say two things. These folks really know Kansas, and they really know their areas of expertise. We're lucky to have them here today. I'm going to start in reverse order from how they're going to speak, starting with Matt All, who is the Senior Vice President, General Counsel, and Corporate Secretary at Blue Cross Blue Shield of Kansas. Previously served in the Governor's Office and the Insurance Department and practiced law and private practice. Very knowledgeable about all the issues we're going to be talking about today. Glad to have Matt here. We have Kevin Curry, who grew up in Kansas City and attended Pittsburgh State, has been responsible for growing the line of business for Coventry in the state of Kansas over the last several years, and again is out there every day working on trying to get insurance products into the hands of people in the state. Appreciate your perspective being here today. Scott Day became a broker about 10 years ago and has been very involved in lots of aspects of health policy since then, currently serving as the president of the Trade Association of Underwriters, as well as serving on the Kansas State Employee Healthcare Commission, and is, again, every day out trying to sell products to people both from the marketplace and outside of the marketplace. We'll give a very interesting perspective on that. Finally, Linda Sheppard, who is right now at the Kansas Insurance Department, serves as the Special Counsel and Director of Healthcare Policy at KID, and probably more than anyone has been involved in on the ground level around all aspects of implementation of the ACA in the state. Previously worked in the Attorney General's office as well as in the private practice of law. So we have, again, a great group of people that really know our state, are doing this on a day in and day out basis, and we really look forward to hearing some of their insights and perspectives. And with that, I'll turn it over to Linda to kick it off for us here.
Great. Okay, Bob, thank you very much, and thank you all for you being here this afternoon. It was fortunate because Bob had provided each of us with just some talking point ideas of some things that he'd wanted us to cover. So Matt and I were making a joke about we didn't really have anything prepared. We were just going to wing this a bit. So anyway, and actually in some ways I think that's actually better. In some cases it's certainly more interesting. And I was really fortunate because part of the questions that Bob asked me to address were some things that we had actually put some information together because Commissioner Prager had made a presentation over for the Public Health and Welfare Committee yesterday, and so I was able to steal from the testimony that we created for her yesterday. So just kind of a high level talking about the marketplace. There are 4 companies that are offering plans on the marketplace. They are Blue Cross and Blue Shield of Kansas, Coventry Health and Life, Coventry Healthcare of Kansas, and Blue Cross and Blue Shield of Kansas City. And the reason why there are 2 Coventry companies on there, I mean, we always technically say there are 4 companies, but the 2 Coventry companies, because Coventry is offering a preferred provider organization plan in all 105 counties in the state of Kansas, and then is also offering an HMO plan in 12 counties through Coventry Healthcare of Kansas. So that's why there's the 2 different companies. There are 72 plans offered on the federal marketplace, 65 individual and 7 shop plans, although technically the shop plans aren't accessible through the marketplace at this point, and we can certainly talk about that later. There are also 12 standalone dental plans offered by Best Life and Health Insurance Company, which is actually a company that's not really been operating in our market in the past, so that was kind of a new entry into our market. And again, they have 6 individual and 6 shop plans that they're offering through the marketplace. All of the plans, and I'm just talking about the health plans, all of the plans have the same basic, the essential health benefit package included in those plans. And obviously the way they vary is by premiums, cost sharing limits, and deductibles. And so when you're looking at the plans, we've talked about the precious metals. So you have the bronze, silver, gold, platinum, and then also the catastrophic plan. And those, we have all of those represented on the marketplace in various areas. As far as premiums are concerned, I guess I would make 2 comments about that. First of all, I was teasing with Matt that I wasn't planning to come here and tell you what the premiums were for all 72 of the plans, although he told me he'd give me a prize if I did it. But anyway, so I think what I will say about this is a couple of things. First of all, and I know Bob was nice enough to provide all of you with a copy of this is a piece that the Kansas Health Institute put together. They took some of the data, actually they had asked us to provide them with some data from our files on the insurance companies, and they took some of that and tried to put some, make some summary comments about the data. So you have a map here in the state of Kansas. The state ended up being broken down into 7 rating areas to recognize the fact that there's a difference in cost as you move to various parts of our state, to the cost of health care. And then on the back, there is some information that provides you with, with some scenarios for a young individual person, age 28, a family of 4, and then also an older empty nest married couple. So you can kind of see some range of premiums that are on there. Now, obviously, the premiums are going to, because of the rating factors that are in place right now, the rates vary according to your age. To whether or not you use tobacco products, what geographic area you're in, and then obviously family status, whether you're buying a plane for yourself or for family. So it would be pretty difficult to kind of come across and share with you what the premiums are. That being said, one of the things that we did was create our insureks.org website, which does allow Kansans to go on to the website and put in their county, and some other information, their age information, and can actually see all of the plans that are being offered in their area, and along with the premiums. And so the plans appear, tell you which plans are offered in your area. They're ranked, or they're set up in order of premium from lowest to highest. There are also links on there so you can go on and actually look at what we refer to as the SBC, or the Summary of Benefits and Coverage, that gives you more detailed information about the benefits and also the cost sharing aspects of it. So we tried to provide a lot of information, and we actually, that website went live the day after Labor Day, and we had not expected that that was going to become as important as it did. In fact, when the marketplace came up, and as we all know, that didn't go well. So we had a lot of people relying on our website instead. Even though they couldn't get on the marketplace, they could at least look at information about the plans that were available and what the costs were, and then we also had a tax credit calculator on there as well. So I would encourage you to look at this piece, because I think it's very helpful just to give you a summary about that. The other thing that I was going to mention about this was Bob had asked us to talk about the role of federal. I forgot my most important thing. I was so busy up here trying to do this. So yesterday, we had presented some information about enrollment figures, and I had told the committee yesterday that we were expecting to get the updated report on enrollment through the end of January, sometime this week, and in fact, it came out right when I was sitting here preparing for this. So I was busily trying to scramble to pull through this report. It's like 53 pages long, so I was trying to scroll through it. So as of the report that came out today, we have 22,388 Kansans who have enrolled in a marketplace plan. So that's everybody who's enrolled between October 1 and at this point, the end of January. That total was about 14,000 last month. So we have added a pretty significant number this month. And what I always like to say is the number was 1,855 in the report that was released in mid-December. So you can see we've really jumped up on the number of people who have enrolled in the last couple of months. Just some statistical information: 57% of the people who've enrolled are female, 43 male. 34% of the people who've enrolled are age 34 and under, which for some reason we're about 2% higher than the national average. So if you compare Kansas to the national average, we're a little bit higher in that area. About 17% are chosen a bronze plan, 56% a silver plan, 22% the gold plan, and 76% of the people who enrolled did select a plan using financial assistance, so they're taking advantage of the tax credits and or cost sharing subsidies. And I'm just throwing this out there because this was one of the statistics that was handy. At least according to the federal government, there were about 8,900 people who were determined to be eligible for Medicaid or CHIP. And that's based on the Kansas rules, so it's not under the expanded Medicaid rules. It's under the Kansas rules. So anyway, so you got that hot off the press. It just came out right this minute. The next thing, so the role of the Fed versus state of Kansas in the marketplace. Obviously, we're operating under a federal marketplace. The insurance department, what we tried to do was we wanted very much to maintain as much control over the process of the regulation and oversight of the insurance companies that were going to be operating on the federal marketplace. And so we worked very hard in trying to negotiate with the federal government once it was determined that we were going to be a federal marketplace to make sure that we were going to be allowed to continue to do the things that we had traditionally always done with regard to reviewing rates and forms, benefits, and then the subsequent oversight of the companies as they continue to serve consumers in the state of Kansas, and making sure that we would deal with all of the consumer complaints that came in about issues that consumers were dealing with. So for the most part, that was able to be worked out successfully, and we have been very assertive with them about trying to hold on to that power and making sure that if they are making decisions or doing things that affect the insurance companies, that we have an opportunity to know about those things and at least be able to express our opinion. I will tell you, they have done some things in the past few months that we do not think are in the best interest of the market in some cases, or we know are creating just a lot of extra work and effort for the insurance companies, which is not good, and we don't like that. But for the most part, we are given an opportunity, given a voice to express to them what we think about that. So we have, obviously we have still our traditional things. We're responsible for solvency, certainly again responsible for the consumer assistance side, and again maintaining control over making sure that the rate filings and the policy forms are going through us. Outreach and education efforts. Again, I'll refer to Insure KS because that was really our big push, was to try to get Kansas consumers who wanted information about the ACA, thought this was something that would benefit them. We wanted to make sure that they had that opportunity to go and look at that website, get information that they needed, and then make their decision about whether this was something that they wanted to investigate or move forward with getting enrolled. So as I said, in addition to the plan information, we also had our own tax credit calculator on there, so people could go on there and determine ahead of time if they might qualify for a tax credit to help them buy private health insurance. And at some point when we were doing our presentations around the state, we started telling people, particularly when the marketplace wasn't going well at the very beginning, we would tell people, go on our website. If you determine that you're not eligible for a tax credit, or you're not even interested in a tax credit, don't even worry about going on the marketplace. You don't have to deal with that. The plans are, there are plans available for sale outside of the marketplace. same plans, basically the same rates, and so there's really no reason to put yourself through that misery of trying to go on the marketplace if you didn't have to. So we really wanted consumers to know that ahead of time and know that they didn't have to worry about that, and that going through the marketplace was not their only option, depending upon what they were interested in getting. Early experiences of the marketplace. We all know. I was talking to a group at lunchtime today, and and I said, it's fair to say, the secretary herself came out and said that the rollout of the marketplace back in October was a debacle, and that was her word. So, it was not good. It was clearly it was a very frustrating process for the consumers. I know the insurance companies had done everything that they could to try to respond to the various things that they were being asked to do to get ready as we moved toward open enrollment. And I think everybody, as far as I could tell, I think everybody did what they could, and obviously there were limitations based on what was happening in Washington with the creation of the website and how it was operating. So, October was definitely a bust. Things started to get a little bit better in November, and we would notice. So we were talking to people each week that passed. It got a little better. At some point, the secretary was testifying in front of Congress and indicated that she thought things would be significantly better by the time we got to the end of November. And it turned out that was true. Really, it was just like a light switch went off. Right about December 1, we really starting to see a significant improvement in the way the marketplace was operating, and we were certainly hearing that from consumers who were trying to get on, from the agent community who was trying to get on, and the navigators as well. So they were, everybody was was keeping us pretty informed about what was happening out there, and obviously we were talking among the states, and everybody was sharing information about what they were experiencing in their states. But it has improved. Obviously, the enrollment numbers that I just mentioned are certainly an indication that there are more people getting on and continuing, and those numbers are continuing to grow each month that passes. As far as outreach efforts, again, our website was a big push for us. The agent community, and I'm really proud of this because I think just despite whatever kinds of political concerns that we had in our state or any of the other states for that matter, as far as how you felt about the Affordable Care Act and the marketplaces in general. I'm really proud to say that a large number of our members of our agent community stepped up, went through the hours of training that it took to become certified to go onto the marketplace, and have in fact been reaching out and helping people across the state. And and frankly, we knew that was absolutely going to be important. The number of navigators that were going to be available based on the grants that were provided to different organizations in our state, we knew that was not going to be sufficient. And any of you who have had an experience with the marketplace and know what that process is to go through that, there'd been some discussion about, there'll be some people who'll be able to go on and walk through that process themselves. And I'm not saying there aren't people, but I think it's way more complicated than people thought it was going to be. And I think we always, at the department, always knew that we were going to have to rely very heavily on our agent community, and a lot of them stepped up. So that was one of the extra features we added to our website, was the opportunity for consumers to go online and again put in their zip code or their city and get a listing of all of the insurance agents in their area who were certified to help them on the marketplace. They could also get a list of the navigators and the certified application counselors. And we have continued to update that listing that's on there on an ongoing basis. We get that information from the insurance companies directly, so they tell us which agents that they are aware of that have been certified and are appointed by them to sell on their behalf. And we continue to update that, and we continue to get updated information from the navigator organizations about the navigators and the CACs, and some of that information also coming from HHS as well. So the last Friday, the Kansas Association for the Medically Underserved hosted a summit that was intended to bring together a lot of the different organizations in our state, and obviously the navigators, together to talk about outreach as we move into this last 45 days of the open enrollment period for the market. And there was a lot of really great enthusiasm and hope in that room and in that group, and I have I have huge admiration for those individuals who have again gone through that navigator training and are doing the work that they're doing as volunteers. And it was, just as I said earlier, they were very frustrated. The agents were very frustrated, as the marketplace was not working properly, and that's gotten better. So there are certainly some efforts out there. One thing we are doing for the navigator organizations, they are providing us with updated information about enrollment events that they're holding at various places around the state. And again, if you go to insureks.org, we're posting those events on our website that show, so that people can go on there and actually see if there's at their local public library on Thursday night there, from 7 to 9. There will be navigators there, and if you show up there, they'll work with you to help you. So we were happy to put that information up there. HHS, their regional office, had asked us if they could also provide us with some information about some things that they were doing, and other events, either from the CACs or other groups that we don't have as much direct contact with. And we're trying to work with them on getting any of that information up there as well. So, again, our major focus on this has always been we're focused on getting the information out there to people. And some of you, if you've been on our website, our little tagline is, get the facts, get informed, get insured. And that's really been our focus. It is up to people to decide what they want to do, and we just make sure that they have the information that they need to do it if it's something that they decide that they want to work on. So I think I've covered everything, Bob. So.
That's great, Linda. Thank you. I'm going to use the moderator's prerogative to ask one question. The 22,500 that have enrolled as of the end of January that you just gave us hot off the press, do you have any comparison numbers of where expectations were of where enrollment might be through that whole open enrollment period and where we are in regards to that?
I do not. I don't have any projection that we had.
And I don't know of any specific projections that we've seen from the state, but just was curious. Okay, great. Scott?
Thank you very much. I appreciate you guys coming out. We are a broker, and we are registered with the Kansas and Missouri exchanges. We focus primarily in Kansas. We've maybe done a couple applications on the Missouri side, but the history. It was a horrible process, October, November. We wrote our first healthcare.gov application on December 2nd, and it went pretty smoothly, about 40-minute process. I thought it was going to work really good, so we were excited. I set up a bunch of appointments. I've been helping a lot of employers enroll their employees into healthcare.gov. That's been my personal strategy. Got out there, and the first week of December trying to do online apps, and it still is a mess. Even today it's a mess, the website is. I would say since December 2nd, we've enrolled probably 160 people into subsidized insurance. We've been pushing it, working it hard. And I would say 95% of our applications have been done through the telephone call centers. I mean, I've absolutely given up on the website. I can count on problems when I use the website. We get more appeals. We get more people hung up on the verification of their identity. They seem to be able to work around those problems with the telephone call centers. The telephone call centers still have their problems because they're tied to healthcare.gov. I mean, I have had a 5-hour phone call application, and I bless that gentleman who stuck it out for 5 hours. But it's still not easy. I rely on, though, and I'll bless. There's some bad ones at healthcare.gov, but I've had some really good ones, and I praise them. When I get a good one, and I'll keep a hold of that good one and bring in the next applicant. I mean, especially when I'm out at an employer. I mean, I've done that. Next, and we just keep going them. My best day, I enrolled 9 people into healthcare.gov via telephone apps, and the last healthcare.gov operator I got had only done 7 that day, so I felt pretty good. But anything, what we're seeing is if you've got a family and their income is anywhere near CanCare level and they're trying to enroll their family, they will immediately kick the children out. The children get kicked out immediately. So it causes problems in trying to get the family enrolled. I mean, we may have already determined that they're not eligible for CanCare, but it doesn't matter. Healthcare.gov kicks the children out, and we have to apply the children to CanCare. We have to get a denial letter, and then we have to send in to London, Kentucky, the appeal process. And I've got the appeal form. We've done a number of these, and I hate the appeal process. And we have more appeals when we use the website. I'm just going to tell you, I have quit trying, and things changed. I mean, I had a determination letter on a young man. I tried the website again last week, or it was 2 weeks ago. It said he qualified, and we went back in and tried to upload the documents they were requiring from the employer, and I think the program shifted his income to his previous job, and it was showing he had no subsidies. So we're having, what we're doing now is we just call in and cancel the old app. The best move we can make is to cancel any pending app and just start over, because it is such a mess trying to mail in employer statements and stuff like that to London, Kentucky. There's no way to track it. I mean, it's still a nightmare. Last Friday, the whole site was down. My wife had 3 people come in and we had to turn them away. I mean, they couldn't take any apps. The program was down. Last Thursday, I had a gentleman, it took 2.5 hours. We got all the way through. And by the way, the one thing that works really good with healthcare.gov is their subsidy calculator. I mean, it works really nice. I will pre-screen people. They come in, they sit down, they've got their income. We plug it into healthcare.gov, and it'll immediately kick up their subsidy amount, and it also shows you what it does to their plan on the cost-sharing subsidies. And so I'm sitting there, and before we've ever even called healthcare.gov, we've already decided which plan looks good. I mean, because the cost-sharing subsidies, I'm going to tell you, 90% of the people I've enrolled are probably paying $25 a month or less for their health insurance. I mean, we're just writing a lot of low-income business. If there's big winners in this, the low income and the people that were on the Kansas high-risk pool. Those people were there because they could afford those plans. They can afford a gold plan. They're saving a lot of money going to gold plans now. So we have taken all of our high-risk people, put them on to gold plans, and low-income people. Our numbers are a little bit different. I'd say 98% of our people we've enrolled have enrolled in a silver plan. Okay, we're not seeing the 17%. They're taking silver plans, but that's because they qualify for both levels of cost-sharing subsidy. They're getting $0 to $20 a month premiums. I mean, I did a 63-year-old premium policies like $550. They paid $20. Their deductible, the cost-sharing subsidy has been a game changer. I'll flat tell you that. The cost-sharing subsidy has been a game changer. It'll take the deductibles down to 0. We put people in, they have 0 copays in their doctor visits. They get essentially brand name drugs that are subject to deductible. If you got a 0 deductible, that basically means they're getting them for free. And that's all because of the cost sharing subsidy. You and I do not see that. I mean, our plans are high deductibles. I got to meet a $2,500 deductible before my brand name's covered on my plan or whatever it is. But if you fit the right income levels, they're getting Cadillacs. I mean, they're driving off with Cadillacs and they're paying peanuts for them. And that's what we've seen. But we've seen the odd situations. I mean, the CanCare, because they automatically kick the kids over to CanCare. I mean, I've had some parents that Kansas has a common law stipulation, and you know, I've come across young couples, they can't afford to get married. Can't get married because the kids are already on CanCare, has a pending surgery. If we would get married, our combined income would get us great insurance. You know, the young lady had to go without insurance because she could not risk her daughter's CanCare eligibility. Because when they got married, it was going to raise their income up. And so there's unique situations like that we stumble upon. We are not seeing that many in the Medicaid gap. Probably more of our Medicaid gap have been farmers, stuff like that hide their income well. I mean, just stuff like that. I mean, small business owners, they showed $3,000 a year income. They're in the Medicaid, or a little bit more than that, $5,000 a year. Those are more or less the people that have called us. I think the people that truly are in the Medicaid gap are not calling us because they know they don't qualify. They've already gone online, they've checked it out and stuff like that. But the Medicaid gap people, and I don't see much publicity about this, and we just discovered it by accident, they have to complete an appeal process to not be fined. I mean, they have to appeal to the federal government, and it's not an easy application. I've downloaded it. It's about 13 pages, and it's very similar to the application to get insurance. So we think if you got constituents out there, you need to be telling them if they're not getting insurance, they need to appeal to the federal government and send that to London, Kentucky, and otherwise there's going to be a fine coming to them. If they're making under $10,000, they're capped at $95, but they're still going to be under that specter next year. Trying to think. The telephone process has worked best for us. All of our information and knowledge has just come from trial and error. The training to work on the healthcare.gov really doesn't do nothing for us. It was all trial and error, just finding out, calling. By calling in, we can get around the verification process. I just can't tell you. When you go online and apply for health insurance through healthcare.gov, you got way bigger odds of getting stumbled upon and not being able to complete the process and all of that. So I highly recommend a telephone process. Even doing that, I've sat in on over 50 telephone calls. You get to where you anticipate and you know what question. And the healthcare.gov operators, they're all totally different. They're totally different. You'll get one that reads every inch of every line on the application. And then you get others who just skim right through it. And I appreciate those because I've already heard all this over 50 times. But they skim through it. They're cutting corners. I don't know if they are rewarded for more apps, but you'll find, and I always call them newbies. The newbies are reading every line. The old pros are skimming through, and especially when you got families, because they want to plug in, read every line to plug in on this child. But we call them newbies and the old pros there. And if you get into a problem, we just call back. You'll call in and you get in, you start an application, and it goes down. If you call into a call center and they're having troubles, you're better to hang up and get off that call and just call the 800 number again, because maybe that call center in southeast part of the United States was having trouble. We'll get redirected to one in the northeast or the northwest. And so anytime we start sensing there's glitches going on, we want to get off that call and we want to recall again. And we'll get transferred to another call center, and then that call center is working. It's just been not fun, but we learn. We learn how to get people through, and it's been issues. We've had some of them tell us, no way are they going to put us on as the agent. We've had some of them refuse that. We get their application. We've learned. We get the application ID. We track it. We send it into our carrier. But some of them are very good. Some of them are mean and hateful. Whenever I get a good one, I tell them. I figure they're working hard like I am. And I tell them I appreciate them because they do. Some of them do good work. Some of them are not user-friendly. But those are just some of the things that we've been dealing with.
Great.
I'm going to jump in and ask you a question too, Scott, about small employers. You mentioned, just from talking to you, I know that you often go to small employers and work individually with the employees
Yes.
in that company. What is happening with the shop itself, the small insurance, small company exchange, and any activity? Are you hearing any discussion about that as a?
No,
Okay.
that's a Matt question, because Blue Cross is the only one in the shop exchange. I can't offer their products, so I couldn't tell you that. I personally have been going after groups that I know can never get insurance, group health insurance. I mean, the ones I used to run from for years are the ones I pursue now. And the reason that is those employees are the ones who get the good subsidies. I mean, they're going to be on my books forever. It doesn't matter if their rates triple next year. As long as their income stays the same, they're going to stay on the books for me. So, I mean,
One more question, just you said about 160 people you've enrolled. Of your experience, how many, what percentage of sort of enrollees in insurance over the last couple months have been in the marketplace versus other lines of insurance? How big of a part of the insurance business is this right now in Kansas?
well, we had a big push for December 31st enrollments.
For the
Anybody we knew, we pushed and got into December 31st enrollments because we knew what was going to happen with the HSAs. I mean, our office probably sells 90% HSAs. I mean, we've grown up with them, we love them, and everybody gets an educational piece on HSAs. So we pushed a ton of people and wrote a ton of people on the old HSAs. I myself am uninsurable, and I had to take a new HSA. And my premium is higher than it would have been, and I have a $6,300 deductible now. I mean, I used to have a $2,500. So that's the shift in the plans, and we knew that, and we pushed a ton of people to those lower deductible HSAs prior. Since that went away, it's all been low income. I mean, our phone is ringing off the hook from people confused, and they tried to do the healthcare.gov. Now, anybody who is not low income, we totally 100% steer them away from healthcare.gov. I mean, we take them direct to the carrier. I mean, but all of my enrollments have been lower income. They've been our risk pool people who are glad to switch over to the new plans. And the middle class we put on to HSAs prior.
Linda, you or Matt, were you going to jump in about the shop? Comment?
Yeah, I mean, and Matt could certainly comment on this. You know, obviously, at some point in time, you know, HHS did come out and indicate that the shop was not going to be operable if that was not something that the small employers were going to be able to go on to the website to healthcare.gov and do their shop enrollments through that process. And so they basically came back out and said, if you want to get a shop plan. And truthfully, the only benefit to getting a shop plan if you happen to be one of the employers who has been and wants to continue to be able to take advantage of the tax credit, which is available for another 2 years. So that's really the only reason to buy a shop plan. And as Scott indicated, Blue Cross of Kansas is the only company that's offering shop plans that were actually certified to be shop plans. So they can just go directly to Blue Cross and get those plans. You know, we are being told that for 2015 that the shop will be functioning, and you know, we'll wait and see whether that happens. But yeah, for now, if you really want a shop plan, you just have to go directly to Blue Cross, or if you're not concerned about the tax credit, you can buy a plan from the other companies who are offering small employer plans.
Yeah, that's exactly right. And you get the pleasure of sending an application to that place in London, Kentucky to see if you get the tax credit. So hopefully you get one of the nice people there instead of one of the other ones. So,
It's not fun. Just one more thought. We follow up because we're extremely concerned about our clients not getting their first payment made. I mean, we've had a few fall off because they didn't make that connection. And the phone numbers healthcare.gov gives out isn't necessarily the phone numbers they need to set up for their payment. So we're real stringent. We tell them we've got the other number that they need to call ready, waiting on them. And we tell them, now some people can't afford to take it out in 3 days because it takes about 3 days for it to get from healthcare.gov to Coventry or to Blue Cross is what they tell us all the time on the phone conversations. But we are constantly following up with them. We'll call them a week out, 2 weeks out, encouraging them to get their payment made. Because we have had some who we left messages but never got a hold of them and they didn't get their payment made. And so now we're trying to find out, can they continue to make the payment and get on to the next month and stuff like that. But we worry about that. I mean, because people are people. I'll just say that. They don't follow instructions real well.
And I can actually kind of elaborate on what Scott's talking about now. You know, he kind of gave you guys an overview of the step one of the process. What he deals with is the actual application, getting them through the process. Well, once they complete the application, I mean, it's far from over. If we would have had this meeting about a month ago, you'd see a whole different Kevin Curry sitting up here because we were dealing with some issues. A lot of that had to do with the delays that October, November, the website not functioning properly. Well, then all of a sudden they got it to where it could work. So the floodgates open and the applications just slammed us. Now we're also talking about a process that we were not able to do any testing on until they actually went live. So as you can imagine, that was a little difficult for the carrier saying, you know, you guys can't test it. You can't see how this process is supposed to work. But when we go live on October 1st, you're ready to go. I don't know, it doesn't make much sense. But so with the volume of applications that came in, we definitely had our internal struggles. And even when the website is working, even today, a lot of the information that is feeding over to Coventry from the FFM is not accurate. That's one of the things, a common thing that we see. Just today, I was talking to a lady who signed her family up for a plan. Premium was about $980. Her subsidy was supposed to cover about $850 of that premium. She keeps getting a bill from Coventry saying you owe this $980, and she pays her portion, and she continues to get billed by Coventry. Well, we have our internal processes where we're looking into it, and no subsidy ever fed through from the FFM. So from what we can see, she owes that whole $980. So now she's in danger of getting her coverage terminated because she hasn't paid that entire binder payment. From what we can see, it looks like she has not paid the entire binder payment. So that's just one example of many things that we're seeing out there, and it's just because the data is not feeding over correctly. I know it's something that they are very aware of that is being worked on. You know, that's just one example there. There's, you know, the plan designs, the birth dates, names, anything that is going to cause a problem. When they go in to get a prescription filled, if we have their birth date wrong in our system, they're not going to be able to get that prescription filled. Again, that's just, it's probably just inputting errors. It's coming through wrong. So those are a few things that we are still seeing a lot of frustration with. Like I said, a month ago, people would call HHS and then they would be told you need to call the carrier because now it's past that process. It's in the carrier's hands. So they would call into our office and say, you know, I want to speak to whoever's in charge of this individual product. Well, that was me there for a while, so I'm just happy to be out of the office, to tell you the truth. It was a little crazy there for a while, but things it's gotten a lot better here in recent weeks. The process seems to just be smoothing out a lot. Now, of course, the volume is, I think, more of what we expect to sustain. It's not that triple, quadruple the volume that we're usually used to that we had there once the website started working. So again, with the surge of applications, and they, as you guys know, they extended the deadlines, extended the payment deadlines. That just, it kind of caused a nightmare for the carrier, but also for the consumers out there. So that's where a lot of that frustration came from. A lot of questions I get here, and I know this is something that you guys wanted me to speak on, is, you know, why did Coventry decide to participate on the exchange in 2014? As you know, in Kansas and Missouri, it's Blue Cross and Coventry. There are a lot of carriers who chose not to participate this first year because from a carrier perspective, it is a risk being on the exchange for the first year. But when we looked at everything, you know, we had the provider contracts in place. We have a lot of providers who they were fully on board. They wanted to participate. They wanted to help the consumers, help the state of Kansas. So we were able to get the provider contracts in place, which also allowed us to get a very good price point in the state of Kansas. So it made sense for the carrier. It's going to be beneficial for the carrier, for our providers, and for the consumers. So that's why we decided for 2014 to participate. Now, 2015, it's a question mark right now. One of the other challenges that we are facing is that we're on a very tight deadline to decide, one, are we going to participate in 2015? And now we have to make that decision without really knowing what our claims experience is. It's too early right now in the process to know what kind. We know we took on additional risks that we normally wouldn't take on in the past due to underwriting. So we know that there is additional risk that we normally wouldn't have taken in the past, but how is that going to impact our entire book? So we have a very short timeline to figure that out. So we don't know how that's going to impact pricing for 2015. We have, I believe it's by the end of April, we have to have our products and our pricing filed for 2015 products. As you can imagine, that is difficult when you don't know what your claims experience is. That we don't know. One thing we do know is that hopefully here in the next couple of months that we're hoping for a surge in that 18 to 35 population. Right now, I believe the average age of a policyholder for Coventry 1 is right around the early 40s, I believe 41 or 42. So we do want that to get lower. I know that HHS and the FFM, they are doing some target marketing, trying to target to that population. If you guys have been watching the Olympics, there's been a lot of ads. The NBA, I believe, they're sponsoring. So you see a lot of ads out there where they're trying to target that younger population. And we too agree that that is very important for this bill. Let's see what else was on here. So I mean, that's really what I had on my list to discuss here. I'm sure Matt will have a lot to add from the carrier perspective.
Me, okay. Well, what Kevin said really rings true. I think we've had very similar experiences. The first, we actually had a room, we called it the command center, which sounds kind of fancy, but it's basically just people sitting at tables with laptops in front of them on October 1st, and we were going to get in and see what it looked like, and it was exciting. It was like we were in, the Enterprise, USS Enterprise or whatever. Captain Kirk was there or something, but we had the same experience that all the consumers did when they tried to get in, in some ways it wasn't a huge surprise. It was a big disappointment because we participate with a lot of other blue plans. In an alpha, we're actually not, we don't have IT professionals doing this, but a lot of other blue plans have had IT professionals working with HHS, and we suspected that, to try to test their systems, and we're not, I don't know if Coventry's part of that, but a lot of other carriers are. And so we knew that there was a possibility that there were going to be problems on October 1st. And so it was disappointing, but it wasn't an enormous shock. But as Kevin said, October and November were really, really frustrating, mostly for consumers. They were disappointing for us, but they were really frustrating for a lot of people. And then the floodgates did open. Things got a lot better, as Linda said. I think we've had a better, sort of more favorable feedback about the website than I think Scott has experienced. But I think there are still some problems. But I think we're now settling into more of a sustainable path in terms of our enrollments. We were able to test some transactions with HHS. We did get some 834 testing in advance, so we had some sense of how it might interact with our system. But in some ways, I think there was some luck involved in not having very many applications and many transactions going through in October and November, because you could sort of troubleshoot a little bit. Early on, the data was really lousy. I mean, we had scrambled data. We had data missing. We had so it was difficult to know how to put all that together. It has gotten a lot better. The vast majority of the 834 transactions that we get from the website now have good data, and so we're able to go put them right into our production system. So that is good for us, it lowers the stress level, I can tell you, with our membership area and our IT division. But more importantly, it's been a lot less frustrating for consumers. And so I hope that continues to improve. One of the things that is important to note, though, is that there's still a lot of IT work for CMS and CSIO to do to complete the project. There are functions that don't exist yet. And so what they've had, for example, if you want to add a newborn, you have to go through a special process. You can add a newborn. You can have babies, and they did not prevent that. But you have to go through a special process where they set up a file in this special system, and we have to essentially manually put basically a retroactive effective date to get them on the policy. And we can do that. But those are the kind of things that have sprung up throughout this process since the beginning of October that we've just had to improvise with. And in fact, one of our strategic pillars, we've had our all-employee meetings the past several days. One of our strategic pillars for 2014 is called Observe and Adapt. Observe and adapt. Sounds really nebulous, but that's the mode we're in right now. Because you think about, what we thought this was going to look like. The beginning of 2013, midway through 2013, even October 1st, 2013, it already looks a lot different. There have been all sorts of changes. Due dates have been pushed back multiple times. The shop, sort of died a slow death, and there still is a shop technically, but there's no website for it. And so we've had to adapt for things like that. There's this new grandmothered class of policies. We knew it grandfathered and non-grandfathered. Now there are grandmothered policies. And so we were one of those companies that had canceled a lot of folks, and then we realized we don't have to cancel them. Fantastic. So we sent them another set of letters saying, you're not really canceled. Here's your choice. All right. So those are the kind of things that we have had to do over the past several months. And it's okay. This is what we do. We're not, stomping our feet and angry about it, but it has been an interesting experience and one that's required a lot of improv work, I guess you'd say. I think it's important. There are a few things that I want to mention. I don't want to repeat much more of what's already been said. I think it's important to keep in perspective, keep this whole thing that we're talking about right now in perspective. This is still a relatively small part of the marketplace. The vast majority of our book of business is grandfathered, right? So a lot of these new rules don't apply to most of our book of business. Most Kansans get their health insurance through their employer. And so most of the stuff is, some of this applies to small employers, but if you're in a grandmother policy, it does. There's sort of different groups of small employers. So a lot of small employers haven't had to deal with some of the changes that we're talking about. They may someday. They probably will someday, but not yet. We're talking about a part of the individual marketplace that has really been affected by this. And that doesn't mean it's not important. It doesn't mean it's not important to get it right. It doesn't mean these changes aren't important. But I think it's important to keep it in perspective about how much of this we're talking about. The other thing I want to emphasize again is I've just gave a few examples of how this has changed. My sense of it is that we're going to continue to see changes. We just saw one earlier this week. In fact, I was giving a presentation yesterday for lawyers in Manhattan, and I had my slides finished, including some of the talk about the pay-or-play rule and the delay. And so I had to change them again at home and sort of reload them onto my flash drive because there was another change. And so I think again, we should recognize that there are likely to be more changes as time goes on. And so what we think is going to happen in 2015 may not. The other thing is that we are really in an exceedingly preliminary stage of this whole process. We're not even through the first open enrollment period. We still have 6 more weeks in that. And I think a lot of the estimates, even before this all started, was that there'd be a big rush at the end of it, particularly with young folks. And I think that's probably going to be even more so because of the problems that happen in October and November. There are all sorts of financial mechanisms in the law that will affect the bottom line of the companies that participate in the exchange. The 3 R's that we talk about. There's reinsurance and risk corridors and risk adjusters. And so, Kevin talked about not knowing what our experience is. Even at the end of 2014, when we know what our claims experience was, we don't know what that means financially for ourselves for some time later. We don't know whether there'll be more competitors in the marketplace in 2015 or fewer. We don't know. I think we're planning on staying in the marketplace. That's sort of in our DNA to be wherever there are products to be sold. But there are all sorts of other things that are going to go on that are going to determine whether this first year has been successful, has been unsuccessful, somewhere in the middle. And so whatever we say here today, I'm glad we're doing this. I'm glad we're having this conversation. I found the comments from the other speakers very interesting. But there is the vast majority of this story, even about 2014, is yet to be told.
Great. Well, thank you. Thank the panel for great insights here. There are a lot of questions that remain about what's going to happen. Let's get started with some and see what questions the audience has. We do have a microphone. We're recording this, so if you would just use the microphone and state your name and what your affiliation is, and fire away.
Hi, Beverly Gossage, and a couple of questions. One, we know when open enrollment closes at the end of March, and then we have this long period before people can start to enroll in November for January 1. How will the insurance carriers police these people who find out I need to have a kidney transplant, or I've discovered I have a severe illness? Oops, I want to buy insurance, and there are only a couple of life issues in which they can do that. Employer no longer offering coverage, etc., the divorce situation. How will the carriers police that?
How are you going to police it, Kevin?
You're the lawyer.
All right. I don't know that we're going to police it any differently than we do today. I mean, that we have special enrollment periods in group insurance already.
Group insurance is different because you can just check with the employer, right?
Yeah, we
but
can.
But now you can't do, it's individual policies, so you can't really do that.
Yeah, it's a good question. I don't know exactly what protocols we've set up. I know that we have an underwriting division that's still going to exist, even though we don't underwrite in the individual area, and they do a good job at asking for documentation about everything, and so we'll have to rely on them to do a good job policing that. It's a good question, and it's something we'll have to keep in mind.
And some people don't realize that currently on the individual market, anybody can just enroll at the beginning of any month whenever. Prior to January 1, they could have enrolled in an individual policy.
Yeah.
And if they weren't accepted, they were denied coverage, they could just go to the high-risk pool. When we do away with the high-risk pool, that option no longer exists.
And I think that's a really good point. And I had somebody ask me, I think it's an important point, and people need to understand that. And I applaud all of my colleagues here for trying to get this information out. I had a question yesterday after the presentation I made, and this was, not all lawyers are sophisticated, but it's a relatively sophisticated audience, and they were there to learn about healthcare reform, so presumably they knew something. But I had a question from one of the lawyers afterwards, and he said, my son thinks that because it's now guaranteed issue, that he can wait, and no pre-existing condition limitations, that he can wait till he gets sick, and then he can sign up. And I just said, well, not really. I mean, if that happens in June, as you're saying, Beverly, that they won't be able to sign up. And so it'd be interesting if we polled Americans. Do they fully understand what it means to have an open enrollment period, and what happens if you don't sign up and you get into a car accident in the middle of the year? I think you raise an important point that I think a lot of people may not understand that.
And just a comment, not a question, but Scott, one of the things that I found in enrolling people on the exchange is the Social Security number is an option. We found far fewer problems if you just don't put in the Social Security number, because things that you want to add your son, who's now 46, but he was 25 before, and they won't let you take him off. So you just have to not put in your social works.
Yeah, we keep the kids' socials off.
Other comments about the open enrollment period and the special situations? Other people want to comment about that before we go to the next question?
Yeah, well, I just want to mention, and Beverly, you're absolutely right, and I agree with Matt that I think there is a lack of understanding about this open enrollment. So, when we started doing these, what I refer to as road shows, with these public meetings that we started doing back in September and have continued to do, and we continue to go out and speak all the time. And that is something that really, when I get to my slide that shows the open enrollment periods, that's something that I've really started to stress with the groups that we're talking to now, saying, okay, I've told you it's guaranteed issue, but do you understand, unless you have one of these triggering events, if you come in May and say, oh, now I want to get insurance, you are not going to be able to get it. So we are trying very hard, just with the opportunities that we have to get that information out there. And then I was just going to comment on something that you and Scott were just talking about right now, because we have been hearing, whether it's from the agents or the navigators, or in talking with the companies about the things that they're doing, that there really is this process going on of a problem arises, and we figure out what a workaround is, and then those things are doing that. One of my favorite stories was we had a navigator that had called into the call center, and she was explaining to the call center representative that they were having this issue, and the person sitting next to the call center person at the next cubicle or whatever overheard the conversation, and she said, "Oh, tell them to do XYZ." So I mean, it is really that. It's just really that sort of a moving target process of somebody, the person next to her, the call center rep who she was talking to didn't know what to do, but the person sitting right next to her said, "Oh, try this." And so it really, it's really been going like that. It's just sort of really kind of a Wild West sort of approach.
Hi, Sheldon Weisgrau. Thanks for all of you for being here. Good information. Matt, I want to thank you for trying to give us some context and perspective, because we all run around like our hair is on fire, but this is a long process. A couple of comments before my question from some navigators that know more about what's going on the ground than I do, but I'm told there's a new change of life button for those new babies you were talking about as of yesterday. Change of status button, okay. And in terms of the folks who fall into the Medicaid gap, I'm told that there should be a hardship exemption form, so it doesn't necessarily have to be an appeal, but you may know better than my question is, all right. My question is, a lot of talk about how many young folks are signing up and whether it's going to be sufficient or not, and that's kind of half the issue. The other half is how the insurers, what the age profile the insurers anticipated would be when they set their rates. And so I'm wondering if you guys have a sense yet of whether you are kind of on target with that or you're still needing a lot more young folks. And the context for this is, a couple of weeks ago, WellPoint, who's the biggest player nationally in this, came out and said they were right on target with their actuarial projections of how many young people would sign up. And so they're expecting to make big profits in this marketplace. So I'm just wondering if you guys have a sense of that yet.
I wish I had an actuary here with me, because I don't know what was projected. I know we would like to get a much younger population in there, but I don't know what's going to make or break us. That's definitely an actuarial question.
Our actuary, and I think most actuaries, see doom around the corner all the time. So, he had a sort of haggard look about him last year. But I don't know whether we're on target or not. I mean, we're churning away, just trying to get people enrolled, and I think we're still not sure exactly what we have yet. And sometimes it's still, as I said before, a relatively small group on the exchange. It'll be actuarially relevant. It's not like it's so small that you couldn't draw some conclusions. But it may surprise us. We may think they're going to go in one direction in terms of claims experience, but they may not in 2014. It's hard to say. And then, as I said before, there are all these other mechanisms that, without the risk adjusters, for example, a certain set of claims experiences may mean one thing. With them, they may mean something else financially. And what Kevin said about the short time frame, I mean, it's really interesting. It's sort of an odd situation that we're in, because we didn't even know what our claims experience is going to be, even an inkling for 2014. And we don't know whether we were right or wrong about our premium. We didn't know whether we were right and wrong then about our premiums that we filed back last April. And so we'll have we'll make a guess again in 2014. And even then, because of the risk adjustment mechanisms, we won't find out until mid-2015 what it means financially.
The financial impact.
Yeah.
You'll know your claims experience. And you said by the end of April you have to put your new filings in for the products and the prices.
I was just going to say, the insurance companies are required in Kansas, they'll be asked to submit their filings by April 30th. So, Kevin and Matt are absolutely right. And we knew this as the regulator. We knew that for, they're going to be submitting their rate filings for 2015. Okay, so they're that far out. So once again, there is going to be some of this actuarial guessing game that's going on, and really when they do their rates for 2016, which will happen in April of 2015, that really will be the first time that they'll have an opportunity to really go back and rely on that claims data and be able to really use that to set those rates for 2016. So it's going to be interesting to see what happens. With the rates starting in 2016, when they actually have some real data that they can rely on when they're doing that.
One of the things, this is the odd situation we're in right now. I mean, I do believe that a few years down the road, we'll settle into a rhythm of being able to predict more readily what our claims experience is going to be, what that means in terms of the risk adjusters. It's just right now, it's just kind of an odd situation to be in.
Mm-hmm.
Yes.
Just being on the ground. I was joking, teasing Kevin. I said, I think I've done 3 in that category. I mean, but the ones that enroll are the ones that are low income. I mean, if they are paying $20 a month, they will. I got 32-year-old young men who's paying child support and stuff, and they'll qualify for maybe a 50% subsidy. They won't buy it. I mean, they're in there, they get a subsidy, but it's only paying half the premium. I see them walk away from it.
You have another question?
Randall Allen from the Counties Association. Linda, I would like to ask you if you would repeat some data that you indicated earlier. I just didn't catch it, and that was on the age groups and the percentages. I just didn't. It went by quickly, and I didn't get it. Could you do that, please?
Sure, and I apologize. I know I tend to talk really fast, and I felt like I was trying to get a lot out there. So, yes, the age groups that I had in for us, we had 34% of that 22,388, which is our new number, are age 34 and under, and that's just that's 2%. For whatever reason, it's 2% higher than the national average, and that was really the only one that I had. In that it had pointed out in that area, and I apologize. That report that I mentioned that just came out this afternoon is 53 pages long. If you go through it, you could actually get the additional numbers for percentage of the population that had enrolled, in those plans. So yeah, the 34% was the only one that I scribbled down real quick when I was going through the information.
Is there another question, Scott? Right now, I have a question. We've heard nationally discussion of the use of restrictive networks and different approaches that health plans can use to try to keep costs managed. What was the experience in, Kansas doesn't have a highly competitive market in that way with a lot of restrictive networks and those sorts of things. What happened this year, and are people beginning to maybe think of that differently going into future years, looking at options for containing costs and keeping premiums affordable?
I mean, Bob, I'll just say that in general, the companies, the 3 companies that are on the marketplace for the, for the majority of their plans, just continued to use their existing networks that they had. So yeah, you're right. We've been hearing a lot about the narrower networks and some of the issues that's raised in some other states. Other than the HMO products that Coventry is selling in 12 counties. I mean, it's an HMO product, so that it does include a narrow network, and that's where they did that. And the people that buy those need to understand that that's what's involved when you buy an HMO product. But at least for this year, we certainly are not seeing some of those issues that some of the other states have seen in those much more narrow networks in those QHP plans. But I don't know, Kevin and Matt want to say anything more about that?
Just to add to that, the 12 counties where we do have the HMO product available, we also have the PPO product available. So the consumers do have a choice, and like she said, you have to make sure that they're clear on, when they are purchasing it. If they're going with the HMO product, they are going to have a narrow network, but they still have the PPO. They'll pay more. The premium will be higher, but they do have that option.
And we don't have we have the same network for all the products.
In a related question, most people look at price, and people say as much as you want to talk about quality and services and provider networks and all that. Really, when it comes down to making decisions, most people look at price. Has that been your experience, and how available is the information about the differences in covered services and co-payment structures and networks? How available is that through brokers, through the website? How are people using any of that, or is it really just boiling down to price?
I think it really just depends on what type of consumer you're talking about. There are some consumers that really want a broad network, or they really want to make sure that their provider is in the network, or they're used to a certain brand or a customer service methodology, and so price isn't as important to them. There's some people who want a really rich product because they expect to use services, and so they're going to gravitate toward that, and price is going to be less important to them. But there's some, and I'm sure
And
Scott,
the information's available for them to make those decisions?
I think so. But there are going to be a lot of people who are going to be very price sensitive. So it just depends.
I see the online shoppers getting in the most trouble with that. I mean, they buy on price, and there's nothing there that just distinctly jumps out and explains what the difference is between Coventry's POS and their PPO. We've had not a large number, but we've had probably maybe 10 calls, and they went online and bought, and they were totally not prepared for the plan that they got. And so we've helped them change plans. But it's going to be your online consumers that do that. I mean, because anybody we're talking to, they're fully getting explained, the difference here and there, and what you're paying for when you buy up to a PPO plan versus a POS plan. So that they get educated with us. But
yeah, the information is there online. It's accessible. Are they going to find it? That's where people will get in trouble. If they're going online and they're just seeing that price and they click apply, you need to be a savvy consumer. You need to do the research, make sure that your provider is in network. So that's the people who get in trouble, are the ones who they're just trying to get the process done.
Great. What more? Come back to you.
Karen Johnson from the University of Kansas. I think it sounds like a miracle that we have 22,388 people enrolled. And I wondered if it may be in your 53-page report, but do we know what percentage of those people have come on broker-assisted, navigator-assisted on their own? Do we have any idea how those people are coming on the exchange and getting enrolled?
I'll go back and look at that report. That was not something that I know when we've looked at the reports the past few months, we haven't really looked to see that. For some reason, I'm not thinking that is included on there, but we'll take a look at that. So because I don't know, and I think there's some inability maybe in some ways to do this. Scott referred to the fact that you may have some people who come and talk to an agent or a navigator, and then they ultimately end up going off and doing it on their own, or vice versa. They get started on there and come back. And so I think it might be very difficult to sort of figure out what it is, because I think people may be switching back and forth or making going a different route once they get started one way or another. So it'd be interesting to see what's out there.
And I have two quick questions, and one is absolutely related to that. Lynn, do we know how many of there'd be about 13,500 that would be purchasing private products and not going on Medicaid, because they would have already been eligible for Medicaid? And of those 13,500, how many of them were previously uninsured, or do we know? Or is there any way to know?
13,500, I wasn't sure where you were.
You said that there were about 8,900 that were Medicaid CHIP eligible that would have already been Medicaid eligible prior to PPACA?
Yes.
So that leaves about 13,500. I'm curious how many of those were uninsured prior, or do we know?
We do not know.
That's not in the data. Okay.
That's not one of the...
And then the final question is, when I've enrolled people on the exchange, at the end it will say thank you for enrolling, and your carrier will be in touch with you regarding paying your premium.
Yep.
People want to pay right then and they can't. Do we have any idea when that's going to change?
It's going to take about 24 to 48 hours for that file to make it to the carrier. So we do within 24 to 48 hours, a letter is sent to the applicant. It has a coupon book. It says you can pay by sending a check to this address. You can go to this website and pay, or you can call this number. I think we send 2 letters, and then we also have an automated phone call system that's going to make calls to the consumers to make sure that they get the binder payment.
Yeah, it's fairly similar. Ours was made a lot more complicated when the grandmothering thing occurred, and people we canceled and we're sending out, you can either pay this or you can pay this. You got to pay it by this date or that date, and so it got a little bit more complicated. But yeah, that's basically what we do.
Thank you.
Yep.
And I just had kind of a general question that I completely agree with all of you that there's a huge amount of education that needs to be done. I mean, the amount of either no information or misinformation is just tremendous. So what suggestions do you have? How do we do this?
Yeah, Sheldon, I'll kind of start off here because, and actually I'm going to cheat a little bit because this is some of the discussion that we had at the Navigator Summit last week, and and a couple of you have alluded to this in some of this. This idea of having, in whatever case it is, and I acknowledge that we don't know what the numbers are, of having some of these folks who have never had health insurance in the past going out and buying what I think we all would agree is a very complicated product. I mean, this is not simple. I think those of us have had it for a long time. You sort of take it for granted, and you kind of understand how things work. And I think when one of the things that we've been talking with with the navigators about, and the agents do this all the time, so this is not new for them, is this education process with your clients and with your consumers, of helping them understand what this thing, I'll say, okay, I have this insurance card in my hand now, what do I do with this, and what does it mean, and what are the expectations or obligations I have when I use that product. So I think that's something that we're very interested in. It's like that's the next phase to move into just in this few months that we have before open enrollment starts again, in November, that's sort of the next phase of this is having to work with those folks and understand. So I think, we certainly get calls from consumers in the past have done that, and I expect that it will occur in the future of people calling and saying, I don't understand what's this copay thing, or so I think that's part of it. And I think it's just going to be a process that we're all going to have to recognize that that's an additional direction we're going to have to move now to start focusing on those issues, on these education issues, and on, and unfortunately, I think this first year, it may be a little painful for those folks who have just paid and bought a plan based on cost, and then find out that that's really not going to meet their needs as they go through and use the plan. And it's just going to, I think it's going to be a process until next year.
Let me ask you, Linda, and we'll go down the row here just to respond to that question, but just make any final comments that you may have too. I'll give each of you a chance to respond to the previous question or just make any closing comments. You want to add anything else?
Yeah, I think the one comment that I'd like to make, and in our state, maybe this isn't as big of a deal because I know in talking to some of our sister states, it's been much more of a process. But, as painful as this experience has been, for all of us, for the regulators, for the agents, for the navigators, for the insurance companies, and all of the other parties that are involved in this, one of the things that it has forced us to do is really, as the insurance regulator in the state, to really, really reach out to all of our partners and try to figure out how to work together. I mean, when the agents were going through their training process, I mean, no surprise, this process didn't work very well, trying to get themselves, set up to go through the training, trying to get their identity proofing done. I mean, it was a huge pain. And so I was literally getting calls from agents daily saying, what do we do? This isn't working. How do we get through? And we were running things up the chain. We have our contacts in DC that we run things up to, and we are, I've made a pain of myself, to those people. I know I have, because I'm saying, I've got people here trying to do good work, trying to do the right thing, and we need to get them some help for what they're doing. And then certainly with the insurance companies, oh my gosh, we have worked so closely with them and had to, because they were, all of these deadlines are coming and they are expected to do things. And at the same time that we have a lot of this guidance and direction coming from DC, in a lot of cases, that gets punted back to the state DOI. And so they'll say, oh, well, we're going to let the DOI handle that. So then we've got the companies coming to us and saying, okay, well, what are you guys going to do? What are you going to expect us to do? What are we going to do? Frankly, a lot of times we go, okay, well, what do you guys think? So it became a very collaborative process because we're all trying to figure it out. And Matt's comment about observe and adapt, and that is really what it's been. So in some ways, I actually think this has been a positive experience because it has forced us all to say, all of us that are working in this area of health insurance, that we have got to cooperate with each other to get through this process And Matt's absolutely right. I agree with him. I think this is only the beginning. So this is a work in progress, and will continue out.
Great.
You can't educate the public to that extent. It's not going to happen, and it's because they get their information from so many different sources, and it's misinformation. And I mean, we pride on our clients. They get taught what their insurance product is, and they still get it wrong. They call back a month later and they got it wrong. I mean, it don't matter how pretty the pictures you draw out for them, how it works, they still don't understand. And it's because it's a complicated beast. And there's too much information. If they listen to CNBC, they're getting this. If they listen to Fox News, they're getting this. I mean, I just don't see, because even with brokers like us, where we take the time to explain it, they don't get it. I mean, it's real hard. And so I don't foresee the public becoming suddenly educated about their insurance products. It's going to depend on them finding a trusted person to help them. That's honest, gets them into the right plans, stuff like that. Bob, I made a comment to him that made him laugh. I've been pretty, I have fought this law for 3 years. I have not been a fan of this law. And I made the comment to Bob when he called me that this is going to be our best year, and it's because of the law. I mean, we're going to have record years, and I mean, it's time to write business. I mean, that's what I've had to come to the conclusion. So we're writing anybody. I mean, they come to us, we're reaching out, we're getting them insurance. So it's kind of been humbling in that regard. I mean, on one hand, I totally disagree with the law. I don't like where I think it's going to take us. But on the other hand, it's the biggest opportunity I've ever seen.
Kevin?
Just to add to that, I'm the director of sales over 4 different states, and I will tell you that Kansas, the Department of Insurance, they've done more than any of the other DOIs that I work with to educate the brokers, to educate the navigators, to try to get out there in front of the general public. So I do think that Kansas is doing a good job trying to get the information out there. Like Scott said, you may agree with the law, disagree with it, but the fact is it's here. We've taken it on that we're going to embrace it. We're going to do the best we can to administer this law. And the bottom line is we want to help the end consumer. That's who we're in this for. We want to help them out, and whatever we can do to educate them, to make sure they know what they're purchasing. That's what we're going to focus on.
Yeah, as far as educating the consumer, I mean, I certainly agree with Scott that there's a lot of really bad information out there, and part of it is that the issue is so hot, nationally in the news, that I think sometimes there's more heat than light out there where people get their information, and so it may die down in time, and I think I'm a little bit more optimistic though than Scott is about the long term, our ability to educate consumers in the long term. I do think we'll settle down into a new normal eventually, and so I just think we got to keep sawing wood, Sheldon, and eventually we'll get through that tree. But I guess I would just reiterate that and I don't mean to be repetitive, but I do think it's important to remember that we're really early in this process, and not make too many conclusions now about even what's going to happen this year. And I would echo what Kevin said. I mean, I think we're way ahead here in Kansas in terms of having good regulatory climate, and I think a partner in getting people informed with the insurance department. So we've really appreciated that. And the other thing is, and I'm not here to butter Bob up here, but the Health Institute does a great job giving out really solid, useful information, and it is a source of light in an area that has often too much heat. So I appreciate everything you do, Bob. Yeah.
Well, we give a hand again to the panel for their time.